After COVID, and I think I mentioned to you, my daughter as a kindergarten teacher, we have just seen a real change. I think she's seen it from an educational and preparation standpoint. I'm wondering what has really shown up in the physician practices and in your practice with children in this post-COVID era.
I would say there's three major things we're seeing. There's a lack of vaccines. Many kids didn't go in for their well child visits, appropriately so, to avoid getting COVID. But now they're playing catch up. And along with that catch up, you are now coupled with a distrust of the medical community. The COVID vaccine and the push for it created quite a distrust, and it's hard. Pediatricians are fighting that science versus trust with their patients battle every day. And then your third, somewhat not related to the first two, but definitely related to the pandemic, is we're seeing a lot of mental health with our children decompensating over time. That those children either who were never out in public because of COVID, or those children who were so used to being social, then shut down, and now allowed to go back out, but missed those formative years of developing core relationships. And so those three branches of care are very, very hard hit right now. Hello Pediatrics and pediatric practices work together to ensure that patients are caught up with their vaccines, but also so parents are heard and understood that their concerns are there and we're hearing them, but also looking to protect their kids. And then the behavioral health side, we obviously identify if any children we see are having any mental health concerns to ensure that the pediatric practices are aware of what we're seeing in case they haven't actually seen those children in a few months and can provide services for them through the practice.
That's great.